All right, it's been about a minute. So good afternoon, everyone, and welcome to today's webinar, Critical Public Health Issues in Cannabis Legislation. My name is Daniel Wacker. I'm the Program Development Associate here at the National Office. I'll be the host of today's webinar. We strongly encourage audience and attendee participation, but please use the Q&A function rather than the chat. That way we can keep things organized for the end. But I'll pass it on to Matt Swinburne, who is an associate director at the Network for Public Health Law's Eastern Region in Baltimore, to give you a little more background on this cannabis legislation and the stuff that's happened in the past few months. Matt, to you.
Thank you, Daniel. Welcome, and thank you for joining me today to discuss public health and cannabis legalization. Cannabis law and policy is a field of law that's rapidly evolving. And we're going to, over the course of this presentation, kind of look at what's happening in terms of the change in law and look at some key issues. There's so many issues we could talk about of public health importance in this space, but today we're going to look at the issue of how do we address youth exposure and youth access to cannabis as states are legalizing this. We're going to look at how legalization potentially impacts medical cannabis patients and how do we make sure they have the medicine they need. We're also going to look at, another issue that's a really kind of hot topic right now in this area, which is social consumption sites, public venues where people can consume cannabis. Often thought of like a cannabis cafe, and probably what I think is kind of a sleeper issue that we're slowly getting our minds around is this issue of intoxicating hemp products. And these products present a lot of the same public health challenges as cannabis, and kind of how we have a problem with these products being sold at smoke shops around the country outside of our regulated cannabis system, and kind of look at what's created this issue and what states are trying to do to address this challenge. But before I get into that, I just want to talk a little bit about what the network does in this space and what I do in this space. And so, the network, we study the aspects of cannabis legalization and regulation that are critical to the public's health and social justice. So we cover topics ranging from restorative justice with things like expungement to, how do you properly design products and package these products and advertise these products so that they're not attractive to children, to things like how do you properly regulate something like a social consumption site so that it minimizes kind of the negative impacts that are there. So we look at cannabis legalization as an opportunity to use the law to minimize kind of the challenges of this policy change, but also there are ways to maximize potential benefits from this. And so we have a collection of resources available on our website that covers a broad spectrum of issues. And, we also, work with people in the area of public health, kind of providing guidance and answering questions related to these things. So hopefully this is the beginning of a conversation with some of you here today. Daniel, could we do the next slide? So I said cannabis is a rapidly evolving field, and I want to just give you an idea how quickly this policy is changing. This concept of legalization of cannabis, whether it's for medical purposes or adult use, which folks refer to as adult recreational sometimes. So let's look almost 20 years ago, in the United States, 10 states allowed medical cannabis. So they had legalized cannabis for medical use. The federal government still treats cannabis as a Schedule I substance, and it is, as a result, largely illegal, only really legal within a tightly regulated scientific research context. So this is 19 years ago. Now, a lot's happened since 2004. Daniel, can you advance the next slide, please? So this is the landscape as of this summer. We have 38 states in DC that have legalized cannabis for medical use. And we have 23 states in DC that have legalized cannabis for adult use or recreational use. So this is a period of time where law is changing incredibly fast, and communities and governments are having to learn about the challenges that this policy change brings about. And because we don't have, kind of federal regulation of this product other than the kind of, blanket prohibition, these states all approach the regulation of cannabis in different ways. And so one of the things we do here at the network is study the different ways that states are regulating either the medical use or the adult use of cannabis. Now, how is all this change happening? And I think it's important to understand a little bit about the legal mechanisms that are bringing this about, because as you'll see, really this change is, for the most part, being brought about by the citizens of these different states. So Daniel, can you go to the next slide, please? So with cannabis legalization, we really look at two basic approaches, and I'm going to go over each one just so you understand how this change is coming about. So the majority of states use either what's referred to as a ballot measure or a ballot initiative. And in this situation, the public votes on the issue of legalization on a statewide ballot. So in my home state of Maryland, we voted on cannabis legalization last November on our statewide ballot for, that we had for our governor, was the primary political office that was on the ballot. But how does this question get placed on the ballot for the public to vote on? And there's two different ways. The public can initiate it by collecting, the appropriate number of signatures to get the question placed on the ballot, or the legislature can refer it to the ballot by passing a bill to do this. And that's what my state did. The legislature last year passed House Bill 1, which put the question of legalization on our November ballot for the public to decide. And like I said, this is the approach taken by the majority of states. And I think it's the majority approach because it provides some political protection for our elected officials, that they're just carrying out the will of the people. It is the people who have decided to legalize this. Now, not all of these initiatives are successful. For example, in Oklahoma, we had a failed initiative this year where the attempt to legalize, didn't secure the appropriate level of public support. But we're likely to see more ballot questions in the near future. There's talk that Florida, Ohio, and Nebraska could be putting legalization on the ballot next year. Now, the other approach that states take is just the legislature takes this on themselves and they pass a bill that legalizes cannabis on its own. It doesn't need to go to the public for a vote. And as I said, fewer states take this approach, but we're starting to see more states use this. For example, Minnesota legalized adult use this year through legislation, House File 100 and the corresponding Senate bill. And like I said, we're seeing this in more and more states. And so here are some of the states that have introduced legalization bills this year. Now, Delaware was successful with their bill. None of these other jurisdictions were successful in passing legalization through their legislation. All right, so we understand how this is happening, and it's largely by the will of the people. Now, the big question and the big concern I get from people when I'm working out in the community and working with governments on this issue is the issue of protecting youth. That how will marijuana or cannabis legalization impact children? And the concern is, number one, will it increase their access to cannabis? And then number two, the way that cannabis legalization presents cannabis use, is it going to make cannabis use attractive to children? And so there are really, some important kind of medical concerns about youth cannabis access. And so Daniel, if you could go to the next page, please. And so, what we started looking at this issue, really have to start off with the fact that, with young people, they're going through an incredibly important period of cognitive development. And, early use of cannabis is associated with a range of health challenges, from cognitive impairment to cannabis use disorder, which is the term used essentially for addiction to cannabis, depression, and other mental health concerns. So we're concerned about these using cannabis during this important period of cognitive development, but we also have to think about other issues. And, just common sense, we know that smoking cannabis involves many of the same toxins and carcinogens that are involved with smoking tobacco. So we have this issue that, we're concerned about children's health in this area. And another issue is there's the challenge of, especially with edible cannabis products, either trips to the hospital emergency room or calls to poison control for either accidental or intentional ingestion of these products that can create a lot of medical concerns. And so this is something that, our regulatory system really has to be prepared to deal with if a state makes this transition to cannabis legalization. And so, kind of with this as the background, as one of probably the biggest issues that I hear from folks in the public health space is there's some key policies and laws that states are adopting to try to address this. And I'll look at these over probably the next 5 to 10 minutes. So Daniel, can we do the next slide, please? So one of the biggest issues that's out there in almost every state that has legalized cannabis for medical or adult use purposes has created a system for regulating the advertising of cannabis products, because we don't want to advertise these products in a way that makes it appealing to children. And, children are at a point where they are impressionable, and studies show that they underestimate the risks of cannabis use. So we actually have, and before I go into this, we have resources related to the regulation of cannabis advertising on the network's website that my colleagues and I have made. But when states approach this issue of advertising, there are three basic kind of tools in their toolbox. First is they look at placing restrictions on the medium that is being used to advertise the cannabis product. And the idea here is we don't want to advertise these products in a medium that targets children. And so, what we do, or states do, is they determine whether or not the audience, so, businesses are required to determine whether or not the audience of a magazine or a radio show or, a television program or, an internet site, does this primarily target adults and isn't something that, targets children. So we don't want to be advertising cannabis products when cartoons are on, for example. And what the states do is they create a baseline and determining when a medium is, adult focused. And so they look to see, is the audience expected to be at least a certain percent adults? And when we look at this, the standard is the very bottom, when states use this, is 70%. At least 70% of the audience is expected to be adults. That's the least protective measure that's used, versus Connecticut, which has the most protective measure that requires the medium to be at least 90% adult to be able to advertise on it. So we try to target these things away from children. Now, we also restrict the content of these advertisements. And every state that has a regulatory system around advertising prohibits advertising content that targets children. So they could say something as simple as, your advertising cannot be attractive to children, to providing very specific details of what the advertisement cannot contain in terms of, cartoon characters, images of, different things. They really get into details of what could appeal to children. So it's that content restriction. And we see this, as I said, in every state that has advertising restrictions. Now, physical restrictions this is more about advertising outside. So the issues of, advertising on billboards, advertising on the cannabis businesses themselves, the ability to advertise in public places. And, what we're seeing in this space is states want to, reduce exposure to these billboards or these signs. Some states have a flat out ban on billboards, where others create an exclusionary zone around child-focused areas. So you can't advertise within X number of feet of a school, of a playground, of a recreation center. And the idea is, trying to create that protective bubble for children from this. But states define that exclusionary zone in different ways. So you could see New Jersey, that exclusionary zone is only 200 feet, whereas Connecticut, it's 1,500 feet from one of the protected areas. And we see other things that are trying to essentially, decrease the attractiveness. Some states, prohibit lighted signs on cannabis businesses. So it's not, they're drawing attention at night. Others restrict the size of the signs. So there are different efforts going forth to try to address this issue of advertising attractiveness to children, because it's a big issue and every state addresses this differently. Daniel, can we go to the next slide, please? So product packaging, and this is a big problem, or especially early on in legalization, before states really caught on to the issue of, wait, these businesses may, package their product in a way that is attracted to children and could lead to accidental ingestion. So, I've got some images on here. The image on the top is probably the worst. Those are stoner patch gummies, cannabis infused gummies. Looks a lot like Sour Patch Kids. So you could definitely have some issues with this, with these products, and we've got different kind of levels of attractiveness to children, kind of in descending order. And those, are really dependent on what the state decides to do in terms of regulating how these products are packaged. And so I'll go over kind of like the key safety measures that I look for when I'm analyzing a state's regulations. So number one, a lot of states require the packaging to be opaque. So you can't see the cannabis flower, or you can't see the cannabis edible within the packaging. You have a cannabis edible, it's going to be confusing for a child if they see something that looks like candy they would normally eat. There's also, a movement to require packaging be tamper evident. So you would know if that packaging has been opened by someone. It's an important tool that states are starting to use. Requiring child-resistant packaging is kind of standard policy. Now, if a state doesn't have that, that's problematic. But really relying on kind of the federal standard there. And, in most states, those stoner patch gummies are now illegal because that's something that goes against this idea of prohibiting packaging from resembling existing food products that are primarily targeted to kids. That's, one of the restrictions that, is required now in many states. So you can't have a cannabis product that, mimics Oreos, something that is really child focused. And what we're also seeing is that states are requiring poison control numbers beyond packaging now, because with the legalization of edible products, states see an increase in poison control calls from these accidental ingestions with children. And, some states, and this is kind of like the cutting edge of where packaging regulation is going, is rather than saying, you can't do this, you can't do that, you can't have packaging with animals or cartoon characters or balloon letters, some states are starting to say, all right, you can have packaging that's a single color, or some states have gone as far as to say, it has to be, essentially like an off-white with black lettering and no logos or symbols. But there's this kind of movement in some states to really restrict the packaging so it's as bland as possible and not attractive at all to children. Next slide, please. And this next thing we're going to talk about is the products themselves. And it kind of goes along with kind of the theme we've been talking about, is that the products themselves shouldn't be designed in a way that they're attractive to children. And this is really problematic with the edibles. And so, having edibles that look like gummy bears creates problems. Having edibles that mimic existing candy is a problem. And we have, the horrible offender of this is this nerd rope, which is a cannabis or hemp, and we'll talk about the problems with hemp product with over 400 milligrams of THC. That is a lot of THC in a product that mimics a child's candy. And so we're seeing restrictions around that because of the issues we've talked about. And we're also seeing states placing potency restrictions on edibles so that, if a child accidentally ingests an edible, it's not a hyperpotent product. And so there's a movement in that direction as well. And the last thing we're going to talk about is education. And this is an important tool that I think states really need to focus in on. Next slide, please, Daniel. So from an education standpoint, people think, okay, yeah, it's obvious we need to, focus education on youth to help them understand the risks of these products, because research shows youth underestimate this risk. And so that's kind of a no-brainer. And most states, as they legalize, are putting in these kind of education requirements. But another thing that really needs to be done is educate parents, because with legalization, we're having the potential for a lot of new cannabis users. And so, educating people on safe use and safe storage of cannabis products in the home. And so on the right, I show a resource that was developed by a Michigan health department that's used to help educate parents about how to safely store their cannabis at home. Because a lot of people with cannabis legalization think, oh, kids are going to have access to cannabis because of these dispensaries that are going to be opening up in the communities. These dispensaries, the value of their license is, potentially generational wealth. They're not going to risk that by intentionally selling products to someone who is underage There are a lot of identification requirements to get into these facilities. Where youth are going to get access to cannabis is through the traditional illicit market and from their parents who are, purchasing cannabis now that it's been legalized. So educating parents is a huge part of protecting kids in this scenario. And, there are a lot of things that I like in terms of like educational and youth focused policies. And one of the things that I want to point out is, I was doing a presentation in New Jersey for one of the state's nursing associations. And I pointed out to them that New Jersey takes some of that tax revenue from cannabis sales and uses it for this underage deterrence and prevention account. And essentially, they're using these funds to try to create programs and opportunities for kids, this idea of giving them good things to do with their time and getting them invested in these really kind of helpful activities so that there are, more opportunities to them and less I don't want to say free time because that's not the appropriate, but kind of give them opportunities so that they're not looking to, illegal drugs for entertainment in their free time. Next slide, please. All right. So we talked about the policies that we're seeing develop in the area of youth exposure and access. One of the big challenges that happens with legalization is it's often, a state legalizes medical cannabis first. It's a smaller market. They can kind of learn and develop this program before they take on the bigger challenge of adult use legalization, where it's a much larger system, but also in terms of, kind of the growth in this area, medical cannabis legalization was more politically viable years ago to legalize. And so you've created a patient base that relies on cannabis for a lot of medical conditions, many of them very, very serious. And so with adult use legalization, you're going to have a huge influx of cannabis users to this legal market. And so what happens to those medical patients who need access to cannabis for medical purposes? So, states have to struggle with this issue. And I'll give you an example. So I was at the hearings for the cannabis reform bill here in Maryland. And one of the legislators pointed out, when we go live, like our current production capacity could meet 20 to 30% of the expected demand. I'm concerned about making sure that, as we up our production capacity to meet this demand, medical patients aren't getting lost. And, part of it is, expanding what existing growers can do in terms of their production limits, and the other issue is like, how quickly can we get new licenses to make sure we don't have this shortage? But there's going to be a transition period where this will be a legitimate concern. And so states are looking at different ways to kind of make sure that people who need cannabis for medical purposes actually still have access to it when the market really opens up. And so next slide, Daniel. This is an area, that states are really trying to tackle now and realizing that this can be a challenge. And I've highlighted a couple different approaches. Highlight my own state first. I think Maryland's done some really interesting stuff here. First, they said all high potency products are reserved just for medical patients. And so this is a category of products. You often hear cannabis concentrates that have a very high THC percentage. And people are concerned about this with recreational or adult use. But there, can be medical patients who really need this high concentration product for its medical effects. And so, it was kind of a two birds with one stone, where we're minimizing some of the public health challenges in that recreational market by keeping these products for the medical market, but at the same time ensuring that there isn't competition for these products for the medical patients who really need them. Now, dispensaries, kind of the businesses that sell directly to consumers. Maryland said you either have to have some hours set aside that are just for medical patients, where they're the only ones who can purchase cannabis, or you have to have kind of a separate checkout procedure so that medical patients aren't stuck in line behind folks who are purchasing for recreational use. And, the other thing that Maryland did in its regulations is say, we're placing a general requirement on these businesses to ensure that they have sufficient inventory, just kind of a general requirement on these folks. And that's something you see in a lot of states. A lot of states, when they're trying to address this, will say, all right, dispensaries, you need to have an inventory plan that explains how you're going to make sure that medical patients will continue to have access to their medicine in this transition. Michigan has an interesting approach. It requires separate inventories so that the products for medical folks and the products for adult use are separate. Missouri, does this inventory plan, kind of that I just mentioned and forgot that I had Missouri listed. And New Mexico does an interesting approach. Rather than putting a lot of things in place, like a specific, inventory requirement that a certain percent has to be reserved for medical patients, they've empowered their regulatory agency. And they've said, if this becomes an issue, the regulatory agency can do these different things to try to kind of balance the scales. And, one of these things is requiring the dispensaries to reserve 10% of their product for medical cannabis patients. So having a set aside. Another thing they said, well, maybe, all the new licenses you issue, if we're having this problem, you can say you can only serve the medical market for a certain period of time to give us the opportunity to kind of balance things out. And then, along that lines, requiring growers to reserve a certain portion of their crops for the medical program. So there's a lot of different approaches being used out there to try to make sure that people still have access to their medicine. Next slide, please. All right. This is something that a lot of people that I deal with are really concerned about. And it's this idea of consumption sites or cannabis cafes. And these are public establishments where cannabis consumption is permitted. Every state doesn't allow this, but there are a growing number of states that allow these. In every state, it has to be a licensed business. So, there's a special regulatory process around the operation of these. Not anyone can open them. And all of these establishments, are generally age restricted to 21 years of age. Now, once you get past these kind of basics that I've highlighted in red, there are a lot of other issues that states need to address as they're looking at these. And so, there's concerns like, all right, if we're going to have these cannabis cafes, are you going to allow them to sell alcohol? Are you going to allow them to sell tobacco? And the majority of states, when they address this issue, they prohibit alcohol and tobacco consumption at these establishments. The concern with alcohol, we really concerned about cross intoxication. But as you continue to look at this, you see there's issues of, okay, where are we going to allow this consumption? Inside the business? Will we allow them to have consumption outside the business? Visibility restrictions. We don't want people in the community seeing people using cannabis. And, again, the idea around this is, the youth exposure. So a lot of states have visibility restrictions. But there are a lot of different questions that states need to answer. And probably the biggest issue that I hear discussed in this is the interplay between these facilities and clean indoor air acts in states. And so, there are issues of, are you going to allow the smoking of cannabis inside these facilities? And some states do allow that. And they say, okay, well, we've got to have an isolated consumption area, and there has to be a smoke-free area for employees to observe and monitor this. We're going to put, specific ventilation requirements on there. But some states prohibit smokable products at cannabis cafes altogether. So, if you do that, you don't have these, same kind of public health concerns of, exposing folks to cannabis smoke on an indoor environment who don't want to be exposed. The issue that we struggled with in the area of tobacco regulation for a long time. So, these are some of the challenges we deal with in this space, and it's something that, as states legalize, if they choose to permit these cannabis cafes, that they're going to need to look at. And one last issue that I want to point out is traditionally local governments have had some say on whether or not they're going to allow cannabis businesses within their jurisdiction. It's this idea that they can opt out, even though the state legalized, they can opt out of having businesses in their jurisdiction. They just need to follow a specific procedure to do these opt-outs. We're seeing a change where states are now not giving local government the option of opting out of cannabis businesses in their jurisdiction. So they can't say, we don't want dispensaries here, we don't want a cannabis processing facility here or a grow site here. The one type of cannabis business that we continue to see local authority over is whether or not they want consumption sites in their local jurisdiction. So that is something, even with this transition away from local authority, there is still local authority around allowing cannabis consumption sites. Next slide, please. All right. So this is a sleeper issue that I want to talk about that I get a lot of questions about, and states are just learning to deal with. And it's intoxicating hemp products. So we're going to do a little science, we're going to do a little federal law, and then we're going to talk about the challenges that states are dealing with. So hemp is a cannabis, it's essentially the cannabis plant, but with a very low delta-9 THC concentration. And so at the federal level, in 2018, with the agricultural bill, the federal government legalized hemp as an agricultural product. And they created standards for growing this plant and gave states the opportunity to develop their own regulatory systems around kind of the agricultural practices and the growing of this plant. Now, the idea at the time was, well, hemp has a lot of uses. Hemp can be used as a fiber, it can be used in, food products. It can also be used as a source of cannabidiol, CBD, which is a non-intoxicating cannabinoid or chemical in the cannabis plant that is been used in a lot of wellness products and is actually incorporated into an FDA-approved drug. Epidiolex uses CBD from the cannabis plant to treat seizure disorders. And so there are a lot of products that folks, were imagining from this. And so we've created this regulatory system around growing the plant. But with this passage of this law, they said, FDA, you still have your job of regulating the products that are made from this hemp. And this is where we get some of the challenges, because number one, Congress didn't understand science, so they didn't understand math. And I'll explain what I mean by this in the next slide. So next slide, please. So this is the legal definition of hemp. So it's the cannabis sativa plant, including all of its derivative extracts, cannabinoids, and all these other things. So it's essentially the plant in these products and that are made from it in parts of the plant. Now, there's that THC restriction. So you can only be hemp if you have less than 0.3% delta-9 THC by concentration. And the idea was, oh, this is a very low concentration by dry weight. Now, this restriction of 0.3% by dry weight of THC, delta-9 THC is the primary intoxicant that in the marijuana or the cannabis plant that's in the regulated market, occurs naturally in much higher levels and is the primary intoxicant that folks have been focused on. But when you apply that restriction to the products that are made from hemp, because you can concentrate that in different ways, that's where we start to get into some of the math problems. So let's say you wanted to make an edible candy bar that is a hemp edible, and you wanted to make sure that it complied with the THC restriction, that's 0.3% by weight. Snicker bar weighs around 50 grams. You do the math on that, the maximum concentration of THC it could have and still qualify as a hemp-derived product is 150 milligrams of delta-9 THC. That is a lot of THC. In most states, a serving of THC is either 5 to 10 grams when we're looking at adult use or recreational use. So there's potential to make delta-9 THC products that are very potent, but qualify under federal law as a hemp product. So a lot of states were seeing high delta-9 THC products being sold in smoke shops as hemp-derived products. Next slide, please. This is where, that was the math problem. Let's look at the science problem. Well, delta-9 is the form of THC that is in the highest concentration in the plant itself. There are other forms of THC. These are called isomers. I don't know if you've heard of delta-8 or delta-10. These are different chemical configurations of THC that are still intoxicating, but differ in their ability to latch on to the receptors in our brain. So it may take, for example, folks say delta-8 is 50% as effective in binding to those receptors in the brain. So it gives, it requires more delta-8 to get the same level of high that you would get from delta-9. Well, delta-8 occurs in very low levels in the plant, but you can use science to convert CBD, remember this product that's in a lot of wellness products, into delta-8 THC. And so there was an abundance of CBD, and the industry realized that they could convert that to delta-8 and start to sell these intoxicating delta-8 products as hemp products. So states have seen an explosion of delta-8 products at smoke shops, generally outside of their regulated cannabis systems, because they, are technically considered hemp-derived products. But remember, the FDA, this law said, FDA, you still have your authority to regulate any product that's made from hemp. We've legalized it as agricultural product, but it's your job to address the products that are made from it. So what has the FDA done? They haven't done anything proactive. And they've had the opportunity, and their challenges, in kind of the legal structure of the Food, Drug, and Cosmetic Act, but they haven't established any safety standards for these intoxicating hemp-derived products. So states don't have a federal standard to look to. The things that they have done are pretty reactionary. And I'll show you 2 examples. Next slide, please. So we'll go over this quickly. This just shows the areas that the FDA has authority over. They have authority over food additives, dietary supplements, and drugs. And I won't spend too much time on there because I've realized I've talked too much already. I need to give you time to ask some questions, but next slide, please. So one of the first things the FDA did in response to the explosion of intoxicating hemp products is they put out a consumer update saying, hey, it's kind of a warning, we want to let you know that there's some potential health issues related to these Delta-8 THC products that are being sold all over the place. So, they pointed out, we haven't evaluated these for safe use. We're receiving reports of adverse events related to these products. These products are psychoactive and intoxicating, despite how they're marketed as like a calmer high. And they point out that the creation of Delta-8 from CBD involves a lot of potentially harmful chemicals. And there aren't safety standards at the federal level on their manufacture. And they also said, keep these products out of the reach of your children and pets. So they kind of issued this kind of like, hey, public, let's be careful about these. Next slide, please. And so the other thing the FDA did is they issued warning letters saying to a couple companies back in 2022 that were selling Delta-8 THC products. And basically what they said is, you are selling an unapproved drug. And a lot of this comes down to the type of claims that these businesses were making about their Delta-8 products. You can't make claims about the diagnosis, the ability to cure, mitigate, or treat and prevent diseases unless your product is an FDA-approved drug. And so these were, and this is an idea, we want to protect consumers. And so you see the language of some of the claims that these businesses were making about their products. And so these businesses were told, you need to stop making those claims because the way you're marketing it means they're an unapproved drug and that's illegal. And so rather than, shutting down operations or putting kind of safety measures in place, they are, letting businesses know, the way they're marketing these products is illegal. So it's not kind of a, proactive approach to the challenges that these products are presenting. Next slide, please. So what are states doing? So states are kind of left in this regulatory void where the federal government isn't, being proactive on dealing with these products. And, states, this is an issue that, is kind of new to the show, where states are starting to realize they need to regulate these products because they're undermining their regulatory efforts on their legal cannabis markets. And so, some of the things I'll just highlight, like, for example, Michigan, you can only sell these intoxicating hemp products in the licensed cannabis market. So they can only be sold at dispensaries, state licensed dispensaries in Michigan. And they're, subject to the safety protocols that the state has put in place for their cannabis market. New York took a different approach, said, okay, we're going to create a separate licensing system. If you want to, develop these products and sell these products, you've got to get essentially a hemp license with the state. And this regulatory system that we're putting out for these hemp products deals with a lot of the safety tools we see in cannabis markets: labeling requirements, testing requirements, packaging requirements, all these things. Some states are, less proactive For example, in Oregon, you don't need a license to sell these products. And the state has banned what they refer to in their law as synthetic cannabis derivatives, which is essentially saying you can't sell Delta 8 THC products, but you can sell in Oregon very low level Delta 9 THC products that are made from hemp, but not the Delta 8. And they age restrict those sales to 20. Now, Maryland, this is an issue that we had to deal with in our legalization process. And so our state took a unique approach, and they said, okay, if you want to sell intoxicating hemp products that are of higher potency, that can only happen in our regulated cannabis market. But we're going to allow unlicensed sales of hemp-derived products as long as they have very, very low THC concentrations. And in the definition of THC, they included all forms of THC. So it couldn't be very low Delta 9, but very high Delta 8. And they put the age restriction on. So this is an area where, we need to do, the network needs to do more study on, because it's really kind of an emerging area where states are trying to figure out this. But this is my last slide. I get excited about talking about this stuff. I'm sorry for going on for so long, but I just wanted to give folks a taste of some of the stuff we're dealing with in this rapidly evolving field of cannabis law and policy. So Daniel, I've got about 10 minutes. I'm happy to stay on longer than that. But what are some of the first questions we've got here?
Yeah, let's see. So the first question we have is, what about parents that become impaired and responsible for the care of young children in regards to cannabis legislation? So,
okay, no, this is an important issue, and what we're seeing, and I'll address it through kind of the legislation in this area. So there's a push, that, if someone is legally consuming cannabis in a responsible manner, this shouldn't be held against them in the findings of child neglect or child abuse. So the aspect of kind of parental rights as related to child protective services. And it's also been brought up in the issue of kind of visitation rights and child access in divorce proceedings. And so states are starting to pass laws that protect the rights of legal cannabis users as long as they are using cannabis responsibly. So this would prevent, the loss of their child if they are not using this product in front of their child. They're being responsible and complying with the law. However, none of these laws protect parents who put their child at risk due to their cannabis consumption. They are still subject, to child neglect laws, child endangerment laws. So states are looking to protect responsible use. Not all states do this. And so there's a push in that area, but irresponsible use is never protected at the state level. All right.
great.
The chat has blown up. So
I know that they've been very active, just messaging back to each other about things that were being discussed.
Yeah.
The next question we have in the Q&A is related to consumption sites, and is just how many states allow consumption sites out of, I'm assuming, probably the states that have legislation passed.
Oh gosh, so we have, and I'd have to go back and look at it, but I'll refer you to our website because I can't remember off the top of my head. It is a growing majority. We did research for the state of Maryland as part of the kind of the information gathering stage as they were looking at the reform bill. And so we have a resource that identifies every state that allows cannabis consumption sites and how they regulate those sites. And Maryland was not included on that resource because they're a newer state. Minnesota is not included on that resource because they're a newer state. But we've got, of the adult use states, I know we have over 10 that allow consumption sites. And it's something that, from a medical perspective, I think consumption sites for medical patients are actually important, because if you live in public housing, or you live in an apartment that prohibits cannabis use, and you need it for medical reasons, it could be a real resource. But there are a lot of issues around that. But I would say, if you Google my name and cannabis, you'll get our essentially we have a regulator's toolkit with a bunch of different issues, and we really go into our studies of the consumption sites there.
Great. So the next question we have is regarding youth and cannabis. And this is specifically asking about a discussion about youth who are being treated with medical cannabis.
Yeah, no, this is an interesting area. And we've studied, how pediatric patients, every state that has legalized medical cannabis permits pediatric patients access to the system. However, they have to go, the system, they access the system through a caregiver. And, the caregiver and the patient need to be registered so that they can access. So that caregiver is the one who's responsible for securing the cannabis and administering the cannabis. Now, where states vary is what's required to certify that pediatric patient to get access to medical cannabis. Some states, it's the same process as an adult patient. Other states require that the healthcare provider that certifies that pediatric patient is actually a pediatric specialist. They're a pediatrician, pediatric oncologist, so they have a specialty in children's medicine. Some states, as a safety mechanism, require multiple healthcare providers to certify that medical cannabis is appropriate for this pediatric patient, so that they, in these states, there's the primary physician who certifies them, and then they have to get a second physician's opinion that also supports that. So that's an issue that states, vary on how they approach that. But the big issue we're seeing now in the area of pediatric patients is access to medical cannabis in schools. So, in states that don't address this issue, a child that's on medical cannabis, when they need their medicine, their parent needs or guardian needs to come, get them from school, take them off school grounds, and administer their medication. What states are starting to do in recognizing that, for these pediatric patients, these cannabis products are medicine. And so this is looking at how does a child access their tincture, their capsule, their transdermal patch while they're at school. And so states are starting to pass laws that allow the parent to come on school grounds and administer the medication. Some states are allowing school staff to administer the medication. Some states are even allowing for the storage of medical cannabis products at the school during the day, and some even permit overnight storage. And so this is something we haven't done a deep dive on, but we've done some initial research. Probably in 2019, we were looking at this issue and have some research on it. So that's really the big issue we're seeing in the pediatric space right now, is the issue of access at schools. And that's really kind of a developing area.
Perfect. That actually kind of covered a little 2-in-1 of the question.
Oh, wow. My oversharing was actually beneficial.
Oh, yeah. But so another one is just kind of regarding the math post the 2018 Farm Bill regarding THC derived products. And the question is, 150 milligrams of THC in a Snickers bar versus the typical amount in an edible of 5 or 10 milligrams. Is that correct? If so, why doesn't everyone switch to hemp and avoid the regulatory burden on cannabis?
Well, no, I think the issue is from like a government and public health concern, we don't want people switching to an unregulated product. Number one, there's the issue of potency limits. 150 milligrams of THC is an absurd amount of THC. And you don't want, someone like coming in off the street and saying, oh, I want to try these hemp products and consuming that much. They're going to have, a negative experience and potentially some health issues from that. But also, these products, unless the state has a regulatory system, aren't being tested for contaminants. They're not being tested for microbials. They're not being tested for heavy metals. They're not being tested for a lot of harmful chemicals that can be present in the cultivation of the plant, pesticides, as well as dangerous chemicals that are used in the processing of hemp into these products. So the hemp market, unless it is regulated at the state level, these intoxicating products, really, it shouldn't matter what plant the product comes to. We should regulate all intoxicating products the same way. And that's what we're seeing the movement towards, is that these products need to be tested. They need to have potency restrictions, and we've got to figure out how to address them because they present the same public health issues. Now, from a consumer side, if you're not concerned about the safety of the product and you just want to get a really high potency product, people are doing that through this legal loophole until states start to implement, regulatory measures. So that's kind of the crux of the issue, is that, we don't want hemp issues unregulated because there are a lot of consumer safety issues related to it. Yeah.
Great. So I can stay on for as long as we need, so we can go through these if you'd like. But next question is regarding the legalization trends and how does this impact local, state, and federal government employees?
Well, federal employees, it's still illegal under federal law. So that's a challenge for federal employees. We actually just had a seminar or kind of a mini conference on cannabis legalization and employment. And so when we look at the issue of employment, people need to understand that a lot of the legal protections they expect aren't available because cannabis is still a Schedule I substance under federal law. So, for example, the Americans with Disabilities Act does not protect someone from employment discrimination or negative, employment actions against them for their cannabis use, even if it's for medical purposes, because that federal law has a provision that says none of these protections apply to the use of a Schedule I substance. And cannabis is still a Schedule I substance under federal law. So when you look at employment, you've got to look at federal law and state law. Now, federal law, we've talked about some of the issues, but there are other issues. There is a piece of legislation known as the Drug-Free Workplace Act. It was passed in the early 80s. And it says that anyone that receives a government contract or a government grant over a certain amount have to have a drug-free workplace policy. And in these policies, the employer has to have, essentially a system for addressing illegal drug use. And remember, cannabis is still illegal under federal law. And so you have this issue for federal contractors, federal grantees. They are subject to this federal restriction, and they can lose their funding and they can be banned from receiving future funds if they don't comply with this. So that adds a layer of complication. In addition, at the federal level, there are specific professions that are regulated under federal law that are prohibited from cannabis use. So, if you work in the rail industry, there are federal regulations that prevent cannabis use in that industry. Big rig drivers, federal regulations prevent them from using cannabis. So you have these federal laws. At the state level, it's up to states to determine what protections there are for their employees. Some states provide protections for legal cannabis use, other states do not. So it's really state dependent on whether or not an individual has protections either for their medical cannabis use or their recreational cannabis use. And the states that do provide protections usually limit them to medical cannabis users, but we are seeing some states apply those protections to adult use as well. However, none of these state protections protect an individual who is intoxicated at the workplace or is using cannabis at the workplace.
Great. So the next question is about consuming cannabis and driving, since there are no breathalyzer equivalents.
This is one of the public health challenges that we have, is that, and the research is kind of all over the place. So we don't have a clear idea of the impact of legalization on the issue of impaired driving. It's not permitted in any state. If you are impaired under cannabis, because of cannabis use, you can still be sanctioned for it. Legalization doesn't allow that. But the challenge is, and this is where we get into the science again, is that, with alcohol intoxication, you can easily measure someone's blood alcohol level with the breathalyzer test to determine that they're over the legal limit. But there's not a cannabis breathalyzer test. But let's say, we want to see, we're going to drug test this person and see if there's THC in their system. Well, THC remains in the human body long after its psychoactive effects have ended. So someone could still have THC in their system 30 days after they've used cannabis. And so even the more intrusive testing is not accurate for determining whether or not someone was impaired at that moment. And so, there's a lot more of the kind of looking into the trainings, for law enforcement, for, helping them identify individuals that are impaired by cannabis through kind of more, visual interactive tests. And I know those trainings, there are businesses that are, doing those trainings to help support law enforcement in that area, but I couldn't tell you of the specifics that those trainings involve.
Great. So I'm not sure how much time you have, Matt, but we still have a few more questions if you're willing.
I'm happy to chat about this all day. So
great. I can stay on too. So if you have questions if attendees have questions that are still in the Q&A, we'll try to work through them. So the next question is regarding the Maryland law allowing unlicensed sale of low potency products. How is low potency defined? Are they still products that are intoxicating? If edibles, do the food regulations apply? For vaping products, is there crossover with regulation of nicotine or tobacco containing e-cigarettes?
Yeah, so this is a great question, Rachel, and there's a lot going on there. So first, and this is going to get a little complicated. The potency restrictions they're looking at a baseline restriction of 0.5 milligrams per serving and a maximum THC concentration of 2.5 milligrams. So if this was a container of gummies, hemp infused gummies, no single gummy could have more than 1.5 milligrams of THC. That's very low. That's essentially 1/20th of the potency limit we place on edibles in the licensed market. Now, when you look at that math, that means if you're pushing the most you can in one single serving, that product can't have more than 5 servings. So that gummy container could have 5 gummies. And that's a huge difference from what we've seen prior to that regulation. You know, we were seeing products with 400 milligrams in the package, and now it's down to 2.5. You know, the total package is a quarter of the standard serving for a product. The other side of this is this is where it gets a little more confusing. You know, that's something like those regulations would apply to like an edible or some of these other products. But in this space, you have full spectrum hemp products. And the idea is with a full spectrum, and it's often like an oil or a tincture, the idea is you're getting all the cannabinoids, all the chemicals that occur naturally in the plant. And to get the benefits of all these different cannabinoids, it would be hard to have a product with THC limits that low. And so there's a slightly higher THC limit, and I can't remember it off the top of my head. I did see someone from Maryland's regulatory agency here. If they're still on, they could probably pipe in. But the idea is, in these full spectrum products, they have a lot of CBD. And CBD actually has kind of I don't want to say antagonistic effect, but it actually kind of dilutes the effect of the THC. So the THC in those products, in a way, is counteracted in a large part because of the high CBD concentration in these products. Now, the regulation of these hemp products, this was a huge area of discussion in Maryland's cannabis reform bill. And there's a lot of back and forth on both sides of this. Now, in terms of some of these follow-up questions, they don't fall under, kind of the tobacco regulations, but they're going to be included. If you have smokable hemp product, it is going to be subject to the same clean indoor, should be subject to the same Clean Indoor Air Act restrictions. But, it's one of the key things, and I'd have to go back and look, you need to have the same safety protections in place for vape and products that you have, in your cannabis, licensed cannabis market, if you want to really do this right from public health perspective, just from product safety perspective. None of these, so in terms of the food standards, I think I'd have to look at that again, but it's probably not going to be subject to the same standard food safety protocol. And this is an issue we had with our licensed cannabis products. When you're developing edibles, technically, an edible cannabis product is no longer food, because having cannabis in it is considered an adulterant and it's illegal. So states have to either specifically say our cannabis products are subject to the same food safety regulations, even though they're not food. This is kind of the legal gymnastics, or they say, we've created our own food safety standards specific to the creation of cannabis edible products. And so for the hemp products that go beyond this very low potency, they're subject to all the essentially food safety standards that are part of the medical and adult use cannabis market, because they can only be sold in that market. So they've got to be in compliance with those standards. And I can't remember what the situation is with those very low potency products. Yeah.
Great. So the next thing is regarding how children use cannabis tend to experience other issues, especially mental health issues. And this might be more of a practitioner rather than a legal question, but is there a specific age where these effects are seen most? Or are things simply categorized as any child under 18?
Oh, I have to go in and look at the different studies. I don't know that off the top of my head, but we do know that the human brain is still undergoing important cognitive development into our 20s. So, I think as we tackle this issue, I think there has to be education around that, even for, kind of legal cannabis users, who are on the younger end of that spectrum. 20, if you're 21, you can legally use cannabis. And, I think people underestimate, what the potential impacts are. So, that I'd have to look at the individual studies, that deal with each of those, but I don't remember what the age ranges were for each of those.
And I think piggybacking off of that, kind of more on this side, it's the recent findings between THC and opioid mortality, I guess. There have been recent studies, according to Joshua. It's showing that youth that take THC products are more prone to using opioids, but THC has always been promoted to stop opioid use for those that are current opioid users. So they're finding the reverse. So he was wondering if you could elaborate maybe on that, if you had any information.
I haven't looked at the research recently. I know, this is an area where we're still learning. Like in cannabis science, there aren't a lot of definites, concrete things, because of the way our law is structured. We've made it incredibly difficult to study this, especially doing any plant touching research. So that would be something that, I can't speak specifically to, just because I haven't spent time recently looking at the research around that.
Great. So the next is, are there policies local city or county jurisdictions can pass to address cannabis public health issues, especially youth access and exposure and secondhand smoke exposure, that aren't addressed in any state laws?
So this is where this is an area of challenge, is what authority do locals have in this space? And a lot of times there's this conflict where the state will preempt or prevent locals from regulating on a certain issue, and there's a lot of this preemption happening in the cannabis space. So when we look at what can local governments do, well, if you're in a state that's considering this, look to see if there is an opt-out clause for local government in the bill or in the process to decide whether or not you want these businesses in your jurisdiction. Then the next step is, all right, if you can't exclude businesses or if you want businesses in your jurisdiction, what can you do in terms of regulating these businesses? Now, one thing that every state allows local jurisdictions to do is to exercise their traditional zoning authority. So determining, where these businesses can be located in their community. They can't use usually can't use these zoning powers to form as a de facto ban in jurisdictions. but that zoning authority helps you control the built environment. Now, a key thing that I think in addressing the issue beyond kind of trying to control the built environment and exposure that way is education. Because, educating parents about safe use, about the impact on their health, the impact on their children's health, and educational efforts for kids so that they understand. Because, one of the things we know is that children underestimate the risks involved with cannabis consumption. And I think that's one of the easiest and probably most effective things jurisdictions can do in trying to deal with this issue of youth exposure, because a lot of the things are going to be defined at the state level in terms of those, advertising restrictions and packaging and all those that it's very state defined. And the thing to look out for is, states often with legalization will set aside some of the tax revenue for these education efforts. So there may be grants available to local governments and community organizations to take on, issues of education, prevention, and even substance abuse treatment.
Great, and that actually also kind of tied because Lauren had a question about, is education on safe use and the hazards available to youth, which your previous statement seems like it's a push.
Yeah, this is definitely a push in most jurisdictions with legalization. And folks in public health really kind of focus in on this as a tool. But like I said, a lot of times it's got to educate kids, but we also really need to educate parents. That's the key thing I keep pushing back is like safe storage. And it's keeping it essentially under lock and key and out of sight. So some common sense about that.
Yeah, so regarding safe storage, has the network developed a safe storage fact sheet?
We have not. And I just pulled the fact sheet that I used on my slide was just something I found on a local health department website. So like you can, there are folks who are doing the right thing out there. So you could probably Google, safe cannabis storage, and find some resources, developed by local health departments. And there are vendors in this space that are going to want to be, kind of good business neighbors who are going to, also help educate the community on this, because, you do have, in some states, education requirements placed on the vendors that they have to, provide educational material on safe use and things like that. But there are a lot of businesses that want to partner in a positive way. It's good for their business.
All right, and I think this might be the last question, but so Colorado law set their threshold for driving under the influence of marijuana at 5 nanograms in the blood. Do you consider this to be a fair amount considering what you stated about the ability to detect the drug for up to 30 days or so after use or ingestion?
I don't have, the scientific education to answer that. I think, I discuss it as a challenge, but, in terms of, what the 5 nanograms means, I don't know if that's a good policy, from a scientific perspective. I'd want to talk to, a cannabis scientist about that, but, it is, an acknowledged problem that we don't have good testing, and that blood testing is not a good tool because of the issue of THC existing in the bloodstream long after the effects of impairment. So, is that a good policy? I'd want to talk to a scientist. But, my general feeling is we know that it's a challenge because of the fact that it lingers in the system long after impairment.
Great. And actually, we had one final question come in just about any thoughts or laws about use and access to medical cannabis in long-term care.
Yeah, this isn't something that we've studied, but I know it's an issue that folks struggle with. And, with, even in the hospital setting, are you going to allow patients access to medical cannabis in the hospital setting? And a lot of times it's not just the issue of legality. Has the state, created a system that would allow the administration of cannabis at a hospital or a long-term care facility? But, the policies and business decisions of the facilities themselves. I did a training for one of the big medical centers here in Maryland, early on in Maryland's medical legalization. And, we went over, the letter of the law on a lot of issues. And it really, you have a lot of challenges. It's not just the policy of the healthcare entity itself, but the comfort of the healthcare providers within that system. And so, it's something that, there needs to be a lot of discussion around, because I think, we know that there are medical benefits. The extent of those medical benefits, we need more science to truly understand that. But, depriving someone of medical medicine that could help them, I don't think it's something we want to do, but we need to figure out, all these hoops that we have to jump through that go beyond just the letter of law at the state level. And I think there's a lot of education that needs to happen with providers. I talk to providers who are concerned that, I don't want to certify patients because I'm worried that this will impact my license to practice, medicine. And, explaining to folks that, with legalization, there are protections for you as a healthcare provider, to allow you to do this under state. So, yeah, I think that's a great question. I don't have a great answer other than I think that there are a lot of issues that need to be unpacked with that.
Well, that's great. And so with that, I think we've kind of reached our time. It is almost 1:30, so thank you all for staying on, and thank you, Matt, for staying on longer to answer some questions. I know people have been really active and participative, and they really enjoyed it. But I just want to thank everyone for attending today. And as mentioned before in the Q&A and in the chat, attendees will receive a link to the PowerPoint slides and a link to a recording of the webinar in about a week. And with that, you'll also receive a survey. And if you're willing to fill out the survey just about your experience today, that'd be great. Other than that, I wish you all the best in the afternoon. Have a nice day. Thank you all.